Rural healthcare is a major yet often overlooked issue in the United States. About 19% of the U.S. population resides in rural areas. Timely access to emergency care is a major issue for rural residents. Response times by emergency medical personnel and transport times via ambulance to the hospitals are notably greater than in urban areas.
We're seeing a crisis of hospital closures in the United States. So rural hospitals are closing since 2010. We've now, as of last week, had 82 close. It's not only depriving communities of access, but also jobs. These are hospitals that are providing good paying jobs in the form of nursing, billing offices, business offices, all of the things it takes to run a hospital.
Patients seek hospital care for many reasons. One major issue is those seeking obstetrical care. Pregnant women may have to drive 50, 60, or 70 miles away to give birth.
We've seen over the last several decades the slow kind of closure of obstetric departments in rural hospitals. And we've seen as a result what's being known as obstetrical deserts in the United States. So there's growing parts of the country where it's very difficult to be pregnant and deliver a baby without having to travel a great distance in order to make that happen. And the other thing that's really bad about hospitals closing is that now they represent the employer for perhaps 70% of the primary care workforce in a community. So when the hospital closes, then they have no way of the physician assistants, the physicians, the nurse practitioners find that they no longer have an employer. So a lot of them are forced to leave, and that just leaves, again, that primary care deficit that is so critically necessary for those communities.
Fortunately, there is an organization focused on helping rural health issues.
I'm with the National Rural Health Association. We're a membership organization with over 21,000 members nationwide. Our mission is to provide leadership on rural health issues, and things that we do largely is education, advocacy, and research. And so those are the three primary ways that we engage with our members. So in advocacy, we have a government affairs department in Washington. We have a lobbyist, and then we have 2 employees in the government affairs department that do nothing but work on dealing with Congress and the executive branch on issues relating to rural health. Education, we have 3 major meetings a year. We have our Policy Institute in February of every year, and then we have our annual conference and Rural Hospital Innovation Summit in May of each year. And then we have our Rural Health Clinic Critical Access Hospital Conference in September of each year. And then lastly, we have the research, which we have 8 research centers scattered around the United States that we work with closely through the Federal Office of Rural Health Policy. We relay a lot of information in terms of research.
NRHA seeks advocacy for rural residents for many reasons.
If you look at where all of our energy and food sources come from, it's from rural areas of the United States. So if you're eating and if you're driving your car, most of those resources came from more than likely rural parts of our country. So we look at this as an exchange, basically, between the economic contribution of rural populations to our ability to make the nation run, basically through energy and food, in exchange for the culture and other things that some of our urban centers provide, some of the research and all of the things that they're involved in economically. That contribution we think is really important, and we don't want to see rural residents, as a result, we think they need to be equally accessing services just like anybody in an urban area does.
1 in $5 spent by residents in rural areas is attributed to healthcare.
Well, in a rural economy, the proportion of services, goods and services that are exchanged in rural areas are through healthcare. That includes hospitals, physicians, clinics, nursing homes, home health, anything that's involved in that healthcare sector. And so that 20% is a pretty large proportion of an economy for a rural area. That's why healthcare is so important. So we look at it in 2 different contexts. First of all, healthcare is very important in terms of access. Obviously, people get sick and they need to go to the doctor, and they don't want to have to go a long way. And the other is, of course, that it represents a huge economic development program for many rural areas. So it represents jobs. Like with a lot of the problems we deal with in rural healthcare, there's not a magic bullet answer that will just immediately solve the problem, and that's again part of the unfortunate work that we do. It's very complicated, and the reasons for some of these situations aren't always so easily rectified. So one of the things that we try to do is we set up work plans that help us to try to see what some of the common themes are to some of the issues. And then we work through our Congress, our Rural Health Congress, which is a group of about 40 or 50 people who help set up policy in our association. And then we have a government affairs committee, we have a membership committee. So we have others that are helping us in terms of contributing to the work that we do. And so we rely on a lot of volunteers, I guess is what I'm saying, to make sure that we're representing our members in a way that is helpful to them.
For more information, please visit ruralhealthweb.org for ways to give back or get involved.